So today we are going to be taking a look at theories and models of health promotion and disease prevention and how they can help us initiate healthier behaviors in our community. So the traditional medical model has focused on diagnosing and treating existing health problems. So in this model, the patient will really only visit a doctor if they have some sort of pre-existing condition that needs treatment, needs medication. In this model, health is considered the absence of one of the 5 Ds: death, disease, discomfort, disability, and dissatisfaction. Over the last several years, healthcare has been moving more towards a wellness model, which is preventing disease and health problems before they even happen, adopting healthier habits or getting rid of unhealthy habits relating to diet, exercise, mental health, sleep, various areas. This is centered on the optimal health of an individual and preventing health problems before they arise. The goal is to achieve each individual's optimal health. There are several dimensions in the wellness model, and it's how satisfied or successful a person is in each of these dimensions that contribute to their optimal health. Physical, emotional, intellectual, social, spiritual, occupational, environmental, and financial. Each of those dimensions can contribute to a person's optimal health. So in this wellness model that we are now moving towards and helping patients prevent problems before they arise, there are a lot of individuals that will have to make some changes. They may need to quit smoking, they might need to lose weight, they may need to change the way they deal with stress or find ways to deal with stress. They may require cancer screenings based on age or pre-existing conditions. So it is up to providers and healthcare professionals in the community to help them find ways to make these changes. And here we have the process of change model, which talks about how a person can or will make these changes and the stages of changes in the model. And it's important to know that while providers are trying to help patients make these changes in their life, they need to know at what stage the person is in so they can help them move through the stages and achieve their goals effectively. The stages of change in this model are pre-contemplation, where they are often ignoring or denying the problem, and then contemplation, where they're kind of accepting that they do need to make a change and what are the pros and cons of making the change. Preparation is where they decide what they're actually going to do to make the change, and action is where they actually take the steps towards the goal. Maintenance is when they stick with the change for the long term. The health belief model can help us predict who will make changes, healthier changes in their lifestyle, who may not, and maybe who needs different motivations. Different populations of people may require different resources to make lifestyle and or behavioral changes, and these variables may be demographic or socio-psychological. Individual beliefs may influence action or non-action. An example would be if you have 2 individuals and you tell both of them you really need to lose some weight, eat healthier foods, and exercise more often. You have one that lives in an area with a higher economic status. This person works a 9-to-5 job. They have a beautiful park right next to them where they can exercise after work, or they have a gym that they can join and go to the gym afterwards. The other person, say, works nights. They don't live in a very good area. They live in a lower income community. Maybe for cultural reasons, the stores don't carry as many healthy foods. So telling these 2 individuals they need to make lifestyle changes can be very different, and their perceived benefits and their perceived severity of the situation can be very different, and they may be more or less motivated based on their resources to take action or to not take action at all. This brings us to important strategies and keynotes of health promotion and disease prevention programs. Communication is key. If we can reach members of the community through a provider appointment for an issue they're already having, great. We can suggest ways to move more towards that wellness model of preventing disease and getting healthier habits, getting rid of unhealthy habits to prevent further issues from happening. We can also reach out to the public through public service announcements. We can create health fairs, advertise for them, mass media campaigns, and sending out newsletters to the community. Education, also vital. Any chance we get to educate somebody while they're already at their provider, we can make sure that they're fully educated and informed about healthier lifestyle habits before they leave. We can also create and send out pamphlets to the community, information about support groups or online resources. And really, we can go above and beyond to try to make changes for our community and become in changing laws or policies and environmental conditions to make healthier options easier for all individuals. We can find ways to make recommendations for building healthy and safe environments and expand access to quality care. We really want to be able to empower these people to make healthier choices and eliminate any health disparities that prevents that.